Meanwhile, China is bracing for another attack from its homegrown virus. The Wuhan virus, a resurgence is being reported thanks to a new subvariant called the JN1. Now, JN1 is linked to the Omicron that drove a surge in cases 2 years back. It's from the same lineage. But JN1 carries a mutation, something that gives it extra immune evading capabilities, and that is what makes it so contagious. China's current rate of cases is quite low, but authorities are worried about a rebound. So will the pandemic make a comeback in China? And more importantly, is Beijing prepared to deal with it this time? Our next report tells you.
Residents dragged from their homes. Patients sent away to quarantine camps, strict lockdowns, mass testing, constant scanning of health codes, huge protests. China has seen it all since the Wuhan virus first spread across the country. Since 2020, Beijing has tried it all. There was zero COVID, vaccinations, controlled movement. Then there was reopening. There was deletion of COVID data. Also, how the virus first emerged. Beijing's Wuhan virus story may look like it has come a full circle, but it isn't over yet, even after 4 years. For the rest of the world, the Wuhan virus is a distant memory, but China is wary again. Health authorities predict another resurgence, and it could be fueled by the new JN1 subvariant. The JN1 is a new COVID-19 variant. It is linked to Omicron, but it has greater immune-evading capabilities, and that is what makes it contagious. The WHO has called it a variant of interest, which means they are tracking it. At least 40 countries have detected the JN1 variant. Many of them are seeing a surge. China, too, is bracing for a rise, and it's because of 3 reasons. One is this new dominant variant. Second is a gradual downward trend in influenza. And 3, decline in population immunity. Authorities worry all of this might lead to a Wuhan virus resurgence this month, with the JN1 becoming the most dominant variant in the country. For now, the Wuhan virus cases remain low. Medical services, too, are stable. Most respiratory diseases are influenza. But authorities are worried about an upward trend in cases, especially those linked to the JN1 variant.
With the approach of the winter vacation and the spring festival holiday, large-scale population movement and gatherings may accelerate the spread of respiratory diseases. It is essential to enhance monitoring and early warning, strengthen the management of key locations, and focus on key prevention and control measures.
So is China equipped to handle another resurgence? Hospitals are already preparing. Training programs are on the rise. There is more human resource allocation, and they are using technology to streamline the process. So Beijing looks prepared, but has it learnt its lessons? With China, you can't really tell. Transparency and truth have never been their strong suit anyway.